Why Ebola is a problem. Ebola is a virus that was first identified in humans a few decades ago. Now, since the 1970s, there have been sporadic outbreaks in isolated areas of Africa, including the Sudan, the Democratic Republic of Congo, the Republic of Congo, Gabon, Cote d'Ivoire, Uganda, and so on. This disease has always been particularly horrifying because it kills up to 90% of its victims, and because the victims die in a particularly horrific way by bleeding out of all of their orifices. Now, in the past, during past outbreaks, the disease tended to burn itself out in relatively isolated regions in Africa, so it would either kill everybody or the victims would recover. But in early 2014, the disease appeared in a more populated area of West Africa, specifically in the countries of Liberia, Sierra Leone, and Guinea. The disease has spread widely since then in these three countries, infecting more than 1,000 people and killing up to 60% of its victims. Health officials and government officials have been unable to stop the disease's spread, and several people involved in trying to treat the victims have caught the disease themselves. One of the top medical officials in Sierra Leone has caught the disease and died. 2 American medical doctors have also been infected. The World Health Organization is now saying that the Ebola epidemic in West Africa is out of control. Now, one of the problems in third world countries is that they don't have much of a tax base. The governments don't have much of a tax base. In countries such as the United States, Germany, Canada, Australia, Japan, etc., there's a big middle class, and that is relatively well off, and they pay taxes to the government. And so these governments in these wealthier countries have a lot of money. But in third world countries, typically they have only a very small, rich elite class, and then the bulk of the population is poor. Poor people don't pay taxes because they have no money, and when they're involved in employment, they may be involved in informal employment where that's hard to record, like say selling goods in a market, selling say fruit and vegetables in a market. It's hard for the government to collect taxes from those types of informal employment. So that means that these third world governments don't have much revenue, and therefore they can't pay for all the public infrastructure that governments usually fund in wealthier countries. So they can't afford to have lots of schools, teachers, hospitals, doctors, nurses, and things like sewer systems, water treatment, and so on. Now, that's part of the reason why they're having such a hard time stopping the spread of Ebola, just like they have a hard time stopping the spread of or reducing the prevalence of other diseases that are common in these regions, such as malaria and so on, sleeping sickness, and all types of diseases like that. So, for example, a lot of the other infectious diseases that are common in these areas, like malaria, probably kill a much larger or many more people than Ebola does, or than Ebola is killing right now. And another issue that's tied to the first issue of governments not having enough funding or not having enough money, revenue, is that the population, a lot of the people are uneducated and superstitious, and that's linked to the fact that the government can't afford to pay for schools and teachers and so on. So a lot of these people may believe that diseases are caused by witchcraft rather than believing in microbes, or rather than knowing about microbes, bacteria, and viruses, which are what really causes these diseases. So if they see a bunch of outsiders, when they have this Ebola epidemic, they see a bunch of outsiders and foreigners showing up in their communities, and these outsiders are wearing medical gear, maybe dressed up in protective gear to protect them from catching Ebola, masks and white suits and everything. They see these people suddenly show up in their community at the same time that people in their community have begun to catch this mysterious illness and are bleeding to death from every orifice. The people, these uneducated people, may conclude that these outsiders are the ones who are responsible for spreading the disease, that maybe these outsiders are killing them with witchcraft. So that is probably why you have these reports of health workers being attacked by people in these countries in their when they try to go into the communities to deal with the Ebola epidemic, or educate people about Ebola, or see if there's any victims of Ebola in the community. That they're getting attacked. Some of them are being attacked by the local people, and that's probably the reason why, because the people see these health workers and think that they're maybe causing the disease, or they're coming to the communities to harm them in some way. And so that's partly due to the lack of education and the fact that the government doesn't have the revenue to actually fund schooling for a lot of people in their country. Now, so basically, if the Ebola epidemic had happened in a wealthier country, the government would have been better able to limit the spread of the illness. So basically, if Ebola is a third world African problem, the question is, why should anybody else care? Now, the reason that people elsewhere should care is because Ebola could spread from Guinea, Liberia, and Sierra Leone to other parts of West Africa and Africa in general, and B, to other parts of the world. So, first of all, there has already been a person, one man, who got on an airplane and flew to Nigeria, which is one of the most populous countries in Africa, and basically came down with Ebola. By the time he got off the plane, he was already sick with Ebola. So if somebody could fly from Sierra Leone, Liberia, or Guinea to Nigeria, they could also fly to any other country that has direct flights from those countries. So there are direct flights from Liberia, Guinea, and Sierra Leone to London, Paris, Brussels, and New York City, in addition to other African cities. So that means that a person from one of those countries who may be infected with Ebola could maybe they're not showing serious symptoms before they get on the plane, but after they get on the plane, they might start to suffer from serious symptoms, or after they land in Europe or the United States or another African country, they could start to suffer from serious symptoms, and then they could be spreading the disease. And so, for example, I believe there's a Liberian woman who lives in the United States with her children, whose husband died from Ebola. So if the family is living in the United States, if the family is living in the United States, the husband who had Ebola could have theoretically flown into the United States without realizing he had Ebola, or before he became sick with Ebola, and then spread it to the United States in that way. So the more widespread Ebola becomes in West Africa, the greater the probability that it will be eventually exported to North America, Europe, and other parts of Africa. Now, I strongly suspect that the disease will inevitably spread to other African countries, neighboring African countries. I think it's very difficult. It will be very difficult for them to seal off their borders completely and stop people from traveling across the border, because that's how the disease originally spread. Apparently, people were traveling across the border from Liberia to Sierra Leone and Guinea and so on. And I'm not sure if they have enough money. These governments have the money to really control their borders properly. And now, if say somebody with Ebola from West Africa gets on a plane, flies to the United States or Europe, the government and the health officials in the United States and Western Europe will be better able to prevent the spread of Ebola, because they're better funded, people are better educated and informed, healthcare is better, but still a person with Ebola may infect a handful of people in the United States or in Europe or somewhere else, and people may die. You may have, maybe half of the people who catch it may die. And so I suspect that it may only be a matter of time before somebody with Ebola comes from West Africa into Europe and the United States, particularly if the disease is just spreading widely in West Africa. If it spreads beyond Liberia and Sierra Leone and Guinea, if it spreads into Nigeria or Ghana or Mali or Senegal or any of these other neighboring countries that are near to where the epidemic is taking place right now, then you have the more countries in Africa where Ebola is prevalent, the greater the likelihood of it being exported into another country, into Europe, into the United States, into even any other countries that have the direct air contact, direct flights. I'm not sure which other countries have direct flights, but to West African countries. So that's why Ebola is a bit of a concern to, I guess, it should be an international concern. But at the same time, there are other diseases. Basically, Ebola, even in West Africa right now, Ebola is far from the leading cause of death. So